Yeah. Okay. Let us see. This is a panel of contemporary and new advances. Our function has already been done by Dr. Nalini, who gave an excellent lecture. These are the names. I don't know who all are present. Dr. Chinmay Patki is there? No. No. Dr. Nitin Lal? Dr. Pujil Gulati? Thank you. Dr. Kailash? Yeah. Thank you. Rajiv Sood? Attendance only. Rajesh Taneja? Sandeep Patel? Yes, sir. Dr. Kosab is there. And Kaushal has sent his regrets. Yes, sir. So first we are going to talk about contemporary issues. Contemporary means what is already known to us, what we are doing in day-to-day activity. This was published in Lancet. A systematic review reported the sperm count had decreased by 50 to 60% between 1973 to 2011. Pre-diabetes is also having increased risk of hypogonadism, higher sperm fragmentation, and obesity is also causing oligozoospermia, acerospermia, and men who have oligozoospermia have more of metabolic syndrome. I remember very clearly when I was medical school in 1973-74, when I was in third year, fourth year, our medical books used to say the sperm count is 60 to 120 million. Now it has come down to even 20 million. So that has been the decline in sperm count.
Let's start with the primary basic, very basic questions. Can we quickly enumerate the causes of male infertility?
Can I? So there are a lot of reasons, but of course mostly I think it's the lifestyle modification that is required, because there is increased male infertility due to that. But to diversify it is hormonal, it is lifestyle changes, idiopathic infertility, genetic causes, and of course many male suffering from varicocele. When we come to lifestyle changes, it is more of smoking, alcohol. There is more predisposition towards diabetes, hypertension, and smoking. With that, of course, occupational reasons are also there. Adding to this, there is a lot of EDC today, like endocrine disrupting compounds like heavy metals and pesticides in our day-to-day life today. So yes, these all do contribute to male infertility and compromised sperm count. Anything that you would like to add?
The important thing to highlight here is almost more than 50% male infertility. Still, we don't know the reason.
Yes.
It is still
Idiopathic.
This is a new term. These are all the causes of idiopathic, or she already mentioned. Now we're going to the new term, male oxidative stress infertility. Dr. Prasad was going to take it. Male oxidative stress infertility.
As they say in an exam, I have received the question beforehand, so I suppose my answer will be likely to be in agreement with everybody. But the important thing to note here is, when we say male infertility versus the substantial drop in the count, both quantity and quality wise, you must remember it comes into focus only when he cannot procreate or bring out a child of his own. So sometimes it's a spectrum. So the most important thing, a take-home message is, you may not go only by counts. You will correlate it with the factor that he is unable to produce his own biological progeny. And that is where this factor is important. So oxidative stress was something which was not quantified, which was not understood. But now we have reached a point where we are saying that oxidative stress as a mass, something that was abstract term once upon a time, may be the operational reason why both the quality and quantity of a mass of population has come down, and now we can quantify it also. So the first thing to understand is the concept that the count may not come down to zero, it will drop, but the quality of the functional individual sperm. So the big difference, sir, before I leave it to my other panelists, is that the crown prince who will become the king, the one who will eventually give the baby, has to be in good health along with a group of his other friends. Only then will you have a good outcome.
Yes, I completely agree, because I think the sperm does not define the capacitation or the acrosomal reaction, whether it will occur or not. So that is the real mirror of fertility. And of course, genetic integrity.
We'll come to that.
Just an important carry-home message here. Based on semen analysis, don't take your decisions. Suppose, as sir very rightly correctly said, only if the counts are less does not mean the person will be infertile. I am simplifying his little bit complicated words. So based only on the counts, don't take your decisions. Don't send your patient to अरे आपको तो infertility हो गई because of your semen count you are infertile. I still remember my first. I think I am practicing last 27 years. My first patient, my close friend, his sperm counts were hardly 3 to 4 sperms per high power field. It was seen. Married for 6 months only, was very worried. I was also new. He was new in married life. I was new in the infertility field. I semen analysis करके देख लेते हैं, and I advised him ICSI. And 6 months later, he did not go for the ICSI or IVF immediately. बोला दीपक थोड़ा सा वेट करते हैं. And 6 months later, he conceived naturally. And still in the party get together, he looks at me like this.
I put this slide to show that the oxidative stress is responsible for almost 30 to 40% of the cases with a known factor of infertility. And in an idiopathic factor, which is 50%, it is almost responsible for 80% of the causes of idiopathic infertility. That is something you have to remember when you are talking idiopathic infertility, that 80% of it is the oxidative stress. And this is how the male oxidative stress infertility has been proposed and pointed out, and it almost affects 37.2 million infertile men. And the oxidative stress is acting at how it is causing infertility. She mentioned about capacitation, acrosome reaction, hyperactivation, seminal leukocyte, microorganism, direct addition. All this causing increased reactive oxygen species and decreased antioxidant system and damaging the sperm, the DNA damage, lipid perioxidation and protein damage in the sperm. And this is how this oxidative stress can affect the sperm membrane, sperm mitochondria, sperm DNA.
Okay. Yes.
Sorry. With permission from my panelists, there are 2 points very important to understand. Even if you give empirical antioxidants, there are 2 golden rules to remember. Don't go with your mind saying his count looks near normal, slightly low. There are no parameters like that. The second thing is, everything that you do has to be at least 70 days. Your therapy for this male cannot be evaluated unless 70 days are completed, and let them be complete. This is when his motivation level is highest. This is when he is not frustrated. This is when he has been given
big challenge to tell the patients because this is a fast era and everybody wants results tomorrow.
Sir, you have to tell him only one thing. You want your own biological progeny, give me 70 days of time and I will give you the sperm that will eventually give you your baby. Probably for the new generation, before we touch upon other topics, because this is something I've written on and therefore I think I would like...
It's important.
Yes, we see that since that all these lifestyle changes, right from your kitchen to the office and the occupational hazards, using the laptop on the lab, increasing the temperature, all these things, smoking, alcohol, and of course.
Doctor,
Yeah.
I am from Delhi. In Delhi, the pollution is so much.
Exactly. So that
Semen culture also very important.
Semen contains zinc, and zinc is bactericidal. So semen culture, most of the time it may be so negative.
Yeah.
If it is positive, it may be from the UTI infection also.
So, therefore, prostatic massage was something that was used long ago, and you have to account for the fact that you correlate the semen parameters with the culture report, which has to be done preferably after.
Practically, what I feel, semen culture has no role.
Exactly.
Absolutely no role.
A standard semen culture may not yield the answer
That's a
to your
very good message. Thank you for raising the chapter of infection. And you cannot diagnose pus cell in the semen analysis. You can just diagnose round cells. Round cells can be leukocytes or it can be immature sperm.
And you will misdiagnose.
Yeah, 2 types. Differentiate between them, you have to do peroxidase screening. So if you are suspecting, you can give empirical doxycycline and empirical antibiotics.
You can now culture it after a prostate
Yes.
massage again.
Okay, let's come down to what is the sperm DNA. We are all talking sperm DNA. What are the different types of sperm DNA damage? We have DNA fragmentation, we have been talking. Then we have mitochondrial DNA damage, telomere attrition, epigenetic abnormalities, and Y chromosome microdeletion. Well, there are certain biomarkers. This is recent advances in male infertility. They have found out only one compound which has been identified as a biomarker for male infertility in the seminal plasma. You can have all this seminal plasma, you can check for all the biomarkers, and you can check for sperm telomere length. This is a length of sperm which is generally 10 to 20 kilobyte, and in somatic cell it is less, 5 to 10. The shorter sperm telomere length is associated with infertility. And
This is not used for sperm selection. It is more into sperm selection.
More into sperm selection, but
It's a new test, relatively new test, and still it is experimental in stage.
Yes.
But
then you have plasma testosterone protein. I also read it for the first time.
Sir, if you notice, the DNA fragmentation was covered well in the previous lecture, where clearly they showed which ones would respond to therapy and which ones would not.
We are going to do that. We will come to sperm DNA, don't worry. This is a new test, TAX 101. You measure it in the semen sample, and according to the level, if it is more than 120 nanogram, it is normal spermatogenesis. If level is 5 to 120, there is hyperspermatogenesis or maturation arrest. Less than 5 is only circular cell syndrome. So TAX 101 can be used as a diagnostic marker. And you have clinical correlation. If it is more than 120,